Alright, guys. So we're quickly trying to look at the scope of that's a radiographer scope of practice. So for the radiographer scope of practice, it's more of like you're trying to look at, okay, for a radiographer, what are the things that a radiographer should do, and what are the things that a radiographer should not do. Do you understand? So it's more of like you're also trying to look at the ethics. You understand? So it actually defines professional boundaries. Do you understand? What you should do, what you should not do. Okay, your responsibilities and your competence. So the core responsibilities include patient care. So your patient is first. You have to ensure that your patient is comfortable, is positioned where your patient is prepared, and you're supporting your patient, because you want to do all of this so that you can get a very nice imaging, so that there's no need for repeating the whole process again. So the radiographer is well trained to operate with X-rays, CT scans, MRIs, and ultrasound and fluoroscopy. Okay, so in as much as the radiographer deals with radiation, they should make sure that the patient is safe and the patient is only exposed to the radiation that is needed for them. They should also make sure that the staff in the radiology department are also safe. So clinical judgment, after the image is taken, okay, or even before the image is taken, they can still take medical history, do physical examination, and also after the image is taken, they also interpret the images and write out their own diagnosis. So interprofessional collaboration, they now collaborate with other workers in the hospital to make sure that things are running within the hospital. And of course, they document for everything that happens to the radiology department. They document all of that. Okay, so levels of practice is according to the professional bodies like the Society of Radiographers and the American Society of Radiologic Technologists. It may actually progress through different levels. We have the practitioner, which performs standard imaging procedures. We have the enhanced practitioner, which undertakes specialized imaging and limited reporting roles. We have the advanced practitioner, which provides expert practice, may lead services, and also contribute to research. They also have the consultant practitioner. Okay, so those are the levels that you could actually go at as a radiographer. So influencing factors is any radiographer found in any place is usually under an association. So the association helps in all those checks and balance. All right. So access to medicine. So in some regions, radiographers can administer all those contrast agents and prescribe within defined limits. So technology now, expanding modalities, broaden the responsibility. So the radiographer is supposed to be constantly seeking for education, increasing their knowledge as regard anything imaging. So education and training. So higher qualification allow radiographers to take on reporting, advanced imaging, and also management roles.